It was a great experience. People were in tears.
At this Indigenous retirement home in Toronto, a quiet ceremony to smudge hundreds of Moderna vaccines took place before elders and residents received a first dose.
We need to be at the front end of the rollout in terms of working in partnership, for instance, with hospitals here.
The initiative was led by Anishinaabe Health Toronto.
It was an urban Indigenous organization vaccinating Indigenous peoples.
I think trauma was part of that, that connection.
Experts say it's important the rollout of COVID-19 vaccines is culturally safe and trauma-informed.
Things like smallpox and measles wiped out communities. How do you trust what the government is saying is really what's best for you when often it wasn't?
Dr. Anna Banerjee knows how a lack of trauma-informed care can harm families. Banerjee's 14-year-old adopted Indigenous son, Nathan, died by suicide after she tried to get him help.
Someone who is a pediatrician, knows the system. If I get dismissed, then how does the average Indigenous person who's looking for support get the support they need?
There are now more than 4,500 cases in First Nations across Canada, compounding concerns within a population that is at higher risk of COVID complications and faces unique challenges achieving immunity.
Some of these communities, up to 40% of the people are children. And to get herd immunity, you need, at least 70, 80% of the whole population vaccinated.
One half too young to get a shot, the other distrustful given the history, bolstering the need to include these communities in a vaccination process that has historically mistreated them.
That's what was really powerful about what we did, was taking the vaccine to the community so that you're not having to leave to go into a place which has often been, quite frankly, inhospitable.
Anishinaabe Health Toronto has been building trust throughout this pandemic with those hesitant to get tested, bringing COVID-19 testing directly to their doorstep. They'll be back here in February to give residents their second doses and others they hope who didn't get it the first time. Caryn Ceolin, City News.